Good afternoon, welcome. My name is Jessie Miles. I'm the Director of Fitness here at Sun City Summerlin. I'd like to introduce Dr. Kate Zhong, a geriatric psychiatrist, scientist, professor, and businesswoman. Dr. Kate is an innovative leader in Alzheimer's research, brain health. She's the adjunct professor, I try to speak a little bit better today, and Director of Innovations at the Department of Brain Health, University of Nevada, Las Vegas. As the Senior Director of Research, Dr. Kate led the development of clinical research programs to advance new treatment for patients with Alzheimer's, Parkinson's, multiple sclerosis, and traumatic brain injury at Cleveland Clinic Lou Ruvo Center for Brain Health. She is the creator of Cleveland Clinic Brain Health Initiative, for which she was honored with the Healthcare Headliner Research Award and Top Tech Exec Award. Dr. Kate is the founder and CEO of CNS Innovations, LLC, a company dedicated to providing consultation services to advance prevention, diagnose, and treatment of Alzheimer's disease. Dr. Kate is actively involved and serves as a board member for many national and international organizations, such as AARP, Global Council on Brain Health, International Psychogeriatric Association, Girl Scouts of Southern Nevada, Executive Women Council of Vegas Chamber of Commerce, International Women's Forum, just to name a few. Dr. Kate is the proud recipient of many awards. She was honored with Minority Lifetime Achievement Award by Women's Chambers Commerce of Nevada, Women of Success, and Top 100 Doctor by Vegas Incorporated. She was featured in the PBS documentary Makers, Women Who Make America, profiling her as one of Nevada's most influential women. She is married to Dr. Jeff Cumming, a world-renowned neurologist and Alzheimer's specialist. They are the proud grandparents of a one-year-old baby girl, Autumn. Dr. Kate is an animal lover, ballroom dancer, globe trotter, and an avid admirer of classical music and art. Please join me in welcoming Dr. Kate.
Thank you very much, Jessie. Hi, how's everyone doing?
We're doing
I'm
great.
so impressed. We have such a crowd here right after lunch. I hope you had a good lunch. But stay awake, okay? I know what happens after a good lunch. Sometimes people tend to fall asleep. So I'm so excited to be here today. When I look around here, right? So how many of you are over age 55? Okay, almost all of them, right? So you are the exact group of people who are really getting into a stage where you are at increased risk for dementia, for Alzheimer's, among other brain diseases. And I think you probably all have heard about Alzheimer's dementia. You may know someone who has Alzheimer's. You may know somebody's family member has Alzheimer's. So it's very prevalent. The good news is that with a lot of research, advancement, there are so much you can do to substantially reduce your risk for dementia. And the good news is it's all within your control. So that's what I want to share with you today, okay? So I'm going to just talk a little bit about our brain, what happens when we age. Then I will discuss some of the key features or facts of dementia and Alzheimer's. What's the difference between dementia and Alzheimer's? I will also share with you some of the exciting scientific advancement with regard to the diagnosis, the prevention, and the treatment of Alzheimer's. Then I will talk a little bit about some of the risk factors, but more importantly, the ways in which you can build your resilience so you can really take control of your brain health. And I will share with you the 6 pillars of brain health. Finally, I will discuss a little bit about some of the resources, because I believe a lot of you probably really rely on Dr. Google, right? A lot of times just go out on the internet, and frankly, there's just a vast amount of information out there. What kind of information you can trust? What kind of information that you have to be very careful. So I will be sharing with you some really credible, reliable information and resources in which that you can get a lot of data and scientific figures and practical tips and recommendations. So let's just take a look at our brains, right? So our brain really is the most important organ of our body, right? Because we only have one brain, and right now we don't have brain transplant. So you were born with one, you better keep it well, right? So it really controls all the vital function of our body, the breathing, the heartbeat, the swallowing. So literally every step you take and every move you make is controlled by our brain. And we call our brain the mighty 3-pound universe. Why? Because the average weight of an adult brain is about 3 pounds, regardless of your weight, so that it comprises about 1 to 2% of your body weight. If you are like 150, and that's 2% of your body weight. If you're over 300, that's just about 1% of your body weight. So despite the relatively small percentage to the body weight, our brain actually consumes up to 25% of the oxygen and the blood and energy. Think about that for a second, okay? So we have to make sure we hydrate. We have to make sure we got enough oxygen, okay? And the majority of the weight of the brain is coming from the water. Brain is really one of the most sophisticated supercomputer because it has about 100 billion of those nerve cells that we call neurons, and they have all the extensions and the branches over here connecting neurons with each other and sending the chemical signals travels through this information highway at a speed about 300 miles an hour, so really fast, super fast. And then that generates emotions and memories and thinking and thought. That's what makes a human human. And you know that our brain generates about 75,000 thoughts per day. So it's a working horse. It's very busy. It works 24/7. So as the rest of our body, our brain also gets old, right? So what happens when we get old? You know, our hair grays, our skin wrinkles, and our muscle lose our volume, right? So the same aging process happens in our brain. You know that the brain, our brain starts to shrink around age 30. Do you know that? Very early, right? And as we get older, the brain continues to lose its volume, and the speed of the brain shrinkage increases after age 60. So what does it mean? So that means that particularly the portion of the brain which is responsible for memory, for example, the hippocampal area, the volume tends to lose. So that's why as we get older and our brain gets smaller, it's a little bit harder for us to learn new things. The number of the synapses I showed you earlier, the connection between the neurons also decreased, and the speed of the information traveling also slows down. So therefore we realize we also slow down, don't we? And then it's becoming a little bit harder to learn new skills, new information, and it's harder to do multitask. I think that probably a lot of us here share that experience. That's all part of the normal aging process, right? And our brain also becomes more vulnerable to disease, to the external stress, and because the brain is not as supple as it used to be while we were in our 20s and 30s, and we start to experience more of what we call the senior moment. I think that's probably familiar to a lot of us. You might walk into the room and say, what did I come here to do? I just forgot. And darn it, I know that person. His name is just at the tip of my tongue. I cannot get that name right. That happened, right? A lot of times. That's a typical what we call the senior moment. But senior moment is not necessarily Alzheimer's. Senior moment is not necessarily dementia, so keep that in mind. But aging also comes with something very positive, right? So we talk about get older, get wiser, so we are much more knowledgeable, and we are also better with regard to our abstract thinking, compared to some of the 18-year-old, they don't know nothing, right? So you talk about your grandchildren, like they just go and they don't really think through. I don't know what they're thinking. The question is they probably don't, but we do. So. And we talked a little bit about senior moment and dementia. So dementia is very common. Right now, there are about 38 to 40 million dementia patients just in Asia. That's one of the biggest regions in the world. And by year 2050, there will be about 130 dementia patients worldwide. So it's a huge number of patients that will suffer from dementia. Dementia is not normal aging, and dementia is not necessarily Alzheimer's. Dementia is just what we consider is an umbrella concept that characterized by, it's a general term. It really implies that the patient is losing the cognitive function, and the patient is having difficulty with daily function, with memory, with thinking. There are many causes for dementia, and Alzheimer's is one of the most common cause for dementia. I want you to think about that for a second. There are also some other conditions such as stroke, such as Parkinson's, that can also cause dementia. There are also some other medical problems, such as thyroid problem, such as vitamin D deficiency, can all create the clinical symptoms like memory impairment, function impairment, but those are not Alzheimer's, so there's a difference, yeah? Okay. So let me show you a little bit in terms of the prevalence of Alzheimer's. This is a figure from Alzheimer's Association. So as of 2022, there are about 6.5 million people with a diagnosis of Alzheimer's, those over age 65. And that 6.5 million numbers is likely going to double by 2050. So reaching almost 13 million in the United States. And about 1 in 9 people age 65 and older has Alzheimer's dementia. Okay. Majority of those came from the age segment between 75 and 80, comprise about 38%. So this is a very high percentage group. And if you take a look at the overall change of the prevalence of Alzheimer's, it's really age-related. Between 60 to 65, there is about 2% of the population that have Alzheimer's. And from there onward, that prevalence double every 5 years. So here, as you can see that between 65 to 75, there's about 5%, and that number jumped to 13% for those who are between age 75 to 84. By the time that people reach age 85, almost 1/3 of them will have Alzheimer's. But the good news is the 2/3 don't have, right? It's half full or half empty. But I think the important thing is why some people get Alzheimer's and other people don't. So we'll talk a little bit about the risk and resilience. Okay? So age is an important risk factor. Another important factor is sex. So women, 2/3 of Alzheimer's patients are women in the United States. So it's a pretty high number, isn't it? So about 3.3 million of Alzheimer's female patients in the United States. And 70% of the dementia caregivers are also women. And do you know that after age 60, women have more than twice the risk of developing Alzheimer's than developing breast cancer? Yes, exactly. Well, we talk about doing the breast cancer screening, and we should also think about how we can screen our overall cognition and memory, right? And the difference between men and women here is 1 in 6 women versus 1 in 10 men develop Alzheimer's after age 45. Women tend to be diagnosed later compared to men, and after the diagnosis, women tend to decline faster than men do. So it's multifaceted why this is the case. You have seen the age, right? Age is a risk factor. By and large, women live longer, so therefore that tends to increase their risk compared to their male counterpart. But there are also other factors, for example, hormones. After menopause, the estrogen level dropped. The estrogen is believed to have protective effect on your brain, okay? And throughout the lifetime, women have more chances of depression and anxiety, which by itself is a risk factor for dementia and Alzheimer's as well. And women have better verbal skills. We talk more, we are more articulate. But that actually is a downside when it comes to the early diagnosis, because we tend to mask our symptoms better than men, right? When you think about it. So all that combined together and make this women group more and higher risk compared to male. Interesting to say that the African American are about 2 times more likely than their white counterpart to develop Alzheimer's. And for the Hispanic, they are about 1.5 times higher risk compared to the Caucasian to develop Alzheimer's. And again, so there are many factors potentially that can be used, explained to that. And we know that in the minority population, they have a higher incidence of diabetes, hypertension, obesity, and some other cardiovascular diseases. And those are risk factors as well that I'm going to talk about just in a minute. So if you are a minority woman, then you can just imagine your risk is much higher compared to the other groups. Genes, I say this is something that we really cannot change because your mom or dad gave you that, right? So there are 2 types of genes that can influence where a person can develop Alzheimer's, 2 types. One is called risk genes, another is called deterministic genes. How many of you have heard ApoE4 genes? Oh, okay. So the ApoE protein is a protein that is responsible for transporting the lipid and vitamins and cholesterols to your bloodstream. And there are 3 types of ApoE genes. So it's ApoE2, ApoE3, and ApoE4. And you will get 1 copy of ApoE from your mom and 1 copy of ApoE from your dad. And depends what you get. So there could be different combination of, ApoE2, 2, ApoE2, 3, ApoE3, 4, so on and so forth. So the 3 types of ApoE genes have a different role in terms of affecting your chance of getting Alzheimer's. ApoE4 is associated with a higher risk of Alzheimer's. So in the United States, there are about 15% of the Alzheimer's population carries, So in the United States, there is about 15% of the entire population carries ApoE4 genes, okay? But the important thing to remember is having ApoE4 gene doesn't mean you're going to get Alzheimer's. So that's very important to remember. It just means it will increase the chance of you getting Alzheimer's. But so half of the Alzheimer's patients have ApoE4 genes, the other half don't. And there are also people who have ApoE4 genes, they do not develop Alzheimer's. So this is considered as a risk genes. There are some other genes like PS1, PS2, and APP. Those are what we call the deterministic genes. will get Alzheimer's. But only very small percentage of Alzheimer's patients have one of these genes, less than 3%. Okay? So, Alzheimer's. We know that it's a progressive neurodegenerative disorder. And I think that some of you probably are pretty familiar with some of the symptoms, right? So it's really memory loss, language difficulties, and impaired function. And as the disease progresses, there are also personality change as well. And sometimes the Alzheimer's patient can get very combative. And usually those are the symptoms that prompt the nursing home placement. It has a very complex underlying biology, and probably you have heard about plaques and tangles, right? Over the years, we understand the plaques and tangles are the underlying pathology, and you can see that under the microscope. And now we also understand that the neurodegeneration is also a very important underlying pathology. So the whole concept of amyloid, that's A, tau, that's tango, that's T, and N, that's neurodegeneration. So ATN is the underlying biology for Alzheimer's. Why is this important? Because with that understanding, that helps us to develop diagnostic way. We have the blood test, and we have the brain scan, all aimed at ATN. So right now, the diagnosis of Alzheimer's is still primarily relying on clinical evaluation. You go to see a doctor, the doctor will do paper and pencil tests, do some blood work, and then come up with a diagnosis of Alzheimer's. However, so there are blood tests right now available, commercially available for amyloid, and then the tau and the neurodegeneration is under development. And also that there are brain scans available now for amyloid as well as for tau, as well as for neurodegeneration. That's why I want to show you the concept. So, because that also help us to find new treatment, new drug, based on our understanding as to what causes Alzheimer's. With regard to the treatment, obviously there's a pharmacological treatment, and basically it's medication and drug. And then there are also non-pharmacological interventions. So for the treatment with regard to the medication, there are currently 3 types available. And one class is called cholinesterase inhibitor. This is the Aricept. You probably have heard about that. So there are tablet and there are some patch, memantine, and this is a new drug that was approved by FDA as of last year. And this is the injection, this is the IV called Aduhelm, this one. So prior to the approval of this drug, all those are targeted at the Alzheimer's symptoms. With the Aduhelm is really targeted and changing the progression of the disease. So categorically, this is a very different kind of class of medication. And between this one and all the others, there was a 17-year gap. No new treatment on the market for 17 years. So the Aduhelm was the first drug in the last 17 years that was approved by FDA. So it's very exciting. And this is, take a look at this. No quiz after this, don't worry about it. So this is something that we at the Cleveland Clinic at UNL, we have been doing the last 7 years. So this is all the drugs. This is a universe of Alzheimer's drug in clinical trial. So every year we publish this report. So there are a lot of progress that's made in the new treatment for Alzheimer's. So it's very exciting. There are a few new drugs hopefully coming to the market soon. But we know that the best treatment is not drug, right? The best treatment is prevention. You don't get it, so we don't need drug. I think the best treatment is like all the doctors will be out of business. So that's the best treatment. So let's talk a little bit about how can we achieve that? How can we optimize that? We have talked quite a bit about brain health. So what is brain health? You know, you heard about brain health, mental health, cognitive health. Sometimes those terms are used interchangeably. So this is a definition by the NIH, so National Institute of Health. And according to them, the brain health has 4 key components. First is your cognitive health. So it's the way how you think, you learn, and you remember. Okay, that's part of your brain health. And the second component is your motor function. So that is, you make and control your movement. So for example, if someone has Parkinson's, they have a motor function problem, right? So then that means their brain health is impaired. And the third one is emotional function. So this is kind of like part of where the mental health lies in. And it's your emotion response and how you cope with stress. Last but not least is some tactile function. It's your feel and response to sensations such as pressure and pain and temperature. I just showed you a lot of risk factors from age, genes, family history, ethnicity. So those are what we call the non-modifiable risk factors. What does that mean? So no matter how hard you try, you cannot change it, right? So choose your parents very wisely. So other than that, there's very little we can do. So that's why we call that non-modifiable. But the good news is, take a look at this. This is the list of what we call the modifiable risk factors. And this was first published by the World Health Organization and was updated a few years back from like just a handful to up to 12. So from the hypertension, diabetes, obesity, all the way down to the head injury, excessive alcohol consumption, and air pollution are all risk factors for dementia. And so let's take a look at what we can do so that we can reduce those risk factors, so therefore mitigate the risk, right? Make sense so far? Okay. This is a very important study. Usually I don't show data unless I'm talking to doctors and residents. But I want you to remember this study because, as I said earlier, a lot of times people go to Dr. Google, but without a lot of scientific backing. And what I'm going to tell you later on is all primarily based on this fundamental concept. This is a study called Finger Study. It's started in Finland. It's Finnish geriatric study. And this is the first multi-center randomized control study. They have included about almost 1,300 people between age 60 and 70 years old. And then this is a 2-year study. During that 2-year period of time, they implement what they call the multi-domain intervention. That is diet, exercise, brain fitness, control metabolic risk, and sleep, so on and so forth. And see if by helping those people to modify their lifestyle by implementing healthy brain lifestyle, if that can change the course of their overall cognition. Those were the people who were at risk for dementia. So 2 years later, what they found was, yes, indeed, significant benefit were observed among those people who were actively engaged in the multi-domain lifestyle intervention. So that's fantastic news, isn't it? That really gives us a lot of basis for the lifestyle intervention. So I'm going to just list a few. What I want you to pay attention is this. 40% of the dementia cases can be preventable. Wow. The number changes from, depending on which reference you're using. But what that means is that there are so much you can do, right? So you are in control of your brain health. So that's a very important message. I want you to remember that. And then as I mentioned earlier, the WHO has been leading the way, and same thing with CDC, they have the brain health map. And Cleveland Clinic, when I was with Cleveland Clinic, I created with a team called the healthybrains.org with 6 pillars of brain health. And later on, AARP also used 6 pillars of brain health. They are more or less the same with significant overlap, but it's all talking about the healthy brain lifestyle. Let me break that down to you. So the first pillar is physical exercise. Get moving. Study shows that people who stay physically active have decreased risk of dementia and Alzheimer's. I just heard that you have 4 gyms here, so isn't that great, right? So I hope that you all stay active, especially after you hear some scientific data here today. So why is exercise good for you? I think a lot of you probably know that. You don't need to see the data, you just feel good right after your workout, because the physical exercise increases your heart rate, increase your blood flow, increase the oxygen to your brain. What did I say earlier? Your brain needs oxygen, right? So that's very important. And some interesting study also found that the size of the brain, the volume of the brain, particularly those that's responsible for your memory function, tend to increase with exercise. How cool that is, because I talk about the brain shrinkage, right? But by getting engaged with physical exercise, that actually increase the brain volume. So that helps you to improve your memory capability, right? So that's another very concrete example. And also physical exercise increase the feel-good neurotransmitters like serotonins, and then you just overall feel good. Exercise also increase the endorphin and cannabinoid, so that also decrease the feeling of pain and stress. So there are multifaceted benefits of physical exercise, of course including decreasing the anxiety, risk of diabetes, heart disease, so on and so forth, and enhanced memory. So this pillar is the one that has the most scientific data and studies. Exercise is extremely important. And for those who are ApoE positive, which I talked about earlier, those people tend to respond even better to exercise than those who were ApoE negative, according to one study done at Cleveland Clinic. So that even if you are having 1 copy of ApoE4 genes, you can exercise and improve or reduce the risk of cognitive impairment. So that's very exciting, isn't it? I know Ashley is here, and we probably you have helped a lot of residents here in terms of the type of exercise and what you do, but the recommendation is you should get on average about 150 minutes per week of different kind of exercise, a combination of aerobic, strength, balance, and flexibility are important, like walking, jogging, yoga, Pilates, swimming, gardening are important. So here is a reference with regard to the target heart rate. So depending on your age, if you are 30, your target heart rate, you should aim at getting that up to 150. But if you're in your 80 or 70, then obviously the number will drop. So that you can use them as a potential guideline and reference. And when you're working out, that is really the target heart rate you should be aiming at. Okay, so the second pillar is eat smart. After all, we are what we eat, right? So you have probably heard about antioxidant, right? Something like that? Okay, so what does that mean? What is antioxidant? So there are a lot of free radicals floating around in our body. And when they attack your cells, your cell goes through what we call the oxidative damage or stress, and therefore can leading the cell to die. So if you have seen an apple or avocado on your kitchen counter for a while, they turn yellow, right? That's oxidation, that's oxidative stress. So what does antioxidant do? Antioxidant is like a free radical, right? So it attacks, the antioxidant is a scavenger to attack the free radical. So when you have an antioxidant in your system, it attacks the free radical, so that eliminate the risk associated with free radical. As we age, there are more free radicals, like our wrinkles, and the sun damage, the age spot, can potentially be all the result of free radical. So the antioxidant, particularly the food rich in antioxidants, are really good with regard to reduce the inflammation and reduce the oxidative stress to your body and to your brain. How many of you have heard about Mediterranean diet? Quite a few, right? So you understand the salmon is good, the DHA is good, the omega-3 is good, right? Okay, so I want to share with you another diet called the MIND diet, because Mediterranean diet has been in practice for many years, and this is a study done in Chicago. It's a combination of Mediterranean diet and DASH diet. So why this one? Because this is more practical. And I think it's really difficult for people to go on a diet and stay on that for a long time, because after all, we all eat. After all, it's a lifestyle. So I think whatever diet you want to get on, make sure that you can stay on for the rest of your life. You know, with some exceptions, sometimes you have a little ice cream, so on and so forth. But this MIND diet, there are 10 groups bring healthy food, and there are 5 groups that you should limit. Limit means you still can eat it, right? So, you know, come on, we all have a little butter and cheese and ice cream, but you should limit the amount or the frequency of that group of the not so healthy brain food, but emphasize on the healthy. So there are 10 groups. Of course, not surprisingly, green leafy vegetable and vegetable in general. You know, an apple a day is good, but the study really find that particularly berry and blueberry is very, very beneficial to your brain health. And snacking on nuts and cooking with olive oil, so on and so forth. And I like the fact that you can actually have a small amount of red wine, according to the study, about 1 glass for ladies and 2 glasses for men per day, so that's okay. And as a matter of fact, those who drank a little bit of red wine tend to do better than those who didn't drink at all, according to this study. One of the reasons that I want to show you the study, because I think it's really striking in terms of their finding. For people who stay on this diet, they discovered or they found that there is a reduced Alzheimer's risk by about 53%. And it shows it slowed down the brain aging by 7.5 years. Isn't that awesome? That's great, right? So, and this is also practical, and the result is astonishing, and it's published, and it's been adapted by many institutions, homes, and individuals. So this is something that I think is very important to keep in mind. Coffee and tea, there are different benefits, obviously, with coffee and tea, so I'm not going to spend too much time on that. But coffee, it's best to drink black, organic. If you put a lot of sugar, a lot of creamer, that defeats the purpose. I want to touch upon a little bit on sleep. We spend 1/3 of our lifetime sleeping, so that's about 290,000 hours sleeping. And sleep is very important. It's very vital, as a matter of fact, to our brain health, because a lot of our memories are formed, consolidated while we are sleeping. And sleep also clears amyloid from the brain. There's a very interesting study showing that they have 2 groups of people, and one group just keep regular sleeping, another one, they deprive those people from sleeping, so those groups actually stay awake for about 35 hours. What they discovered was that there was a 5% increase of the amyloid in those people's brain, just that one night deprivation of sleep, and how significant that is. So that getting good night's sleep is very, very important. And I think that we all experience from time to time sleep deprivation, jet lag, so on and so forth, and you have poor concentration, you cannot remember things. It also increases the anxiety as well as increase the risk for dementia. So what we advocate is practice good sleep hygiene. The people talk about sleep like a baby, right? So who doesn't want to sleep like a baby? And this is actually my dog. So get pampered, wake up early in the morning. The sleep hygiene means it's the sleep environment, a very good sleep environment, and the sleep behavior. So I think that you all know that, don't look at your cell phone before you go to bed, because the blue ray and stimulate and activate your brain. And get into a comfortable environment in terms of the temperature, in terms of the noise level, and then if your pet is very active, then pet shouldn't be allowed in your bedroom, frankly. I know it's hard. Then also keeping very active during the day. Keep yourself very active and get enough daylight. That's very important, because your brain knows if it's daylight or it's nighttime. And then that if you stay in a room where there's no daylight, that really disturbs the overall normal cycle. So having enough sunshine is very important. Okay, so we have heard a lot about using your brain, right? Brain fitness, brain exercise, computer games, and so forth. I want to introduce you to something called the cognitive reserve, or the brain reserve. What does it mean? So that the brain reserve is really your brain's capacity to resist damages, stress. Some people have amyloid, some people have ApoE, but they don't develop Alzheimer's because they have a lot of resilience. They have a lot of brain reserve. So brain exercise, in fact, helps to enhance the buildup of your brain reserve. So that's very good for you, and that's very, very important for you. So there are different kind of ways in which people can practice how they can build and enhance their overall brain reserve, learning a new language, challenge yourself, learning something new. If you're always driving in one direction on autopilot, right? Well, do that. Take a different route. So that if you're a right-handed person, try to use your left hand. So just switch that up a little bit. Just like when you go to the gym, you use the weight machine. You don't always just do the same. You do your quads, you do your biceps, triceps. Same thing. Think about your brain as an organ that you need to try different ways to strengthen your brain. Stay connected is also very, very important for your brain health. Studies really have shown that people who stay socially engaged and very active have decreased risk of cognitive impairment and Alzheimer's. And this is particularly important during COVID, and even now. Because of COVID, and we are forced into isolation, and isolation can lead into depression, sleep deprivation, anxiety, and that just exacerbate a lot of risk factors for dementia. I think actually all of you here, by the fact you are here today, you are engaged, right? You want to learn something new. You want to get connected. So there are studies showing the cross-generation connection. The older people spend time with the children and vice versa. That has proven to be very, very beneficial. There are some other risk factors that we should think about how we can manage. I touched upon earlier on in terms of the diabetes and hypertension and obesity. All those, and smoking, all those are risk factors. But those are the things you can control, right? Make sure you take your medication. Make sure your blood pressure is within the normal range. Make sure your glucose is under control. As well as prevent head injury. Wear a helmet. Wear your seatbelt when you drive. Something very straightforward. I want to just touch upon one thing about diabetes. Do you know that the diabetic have up to 4 times greater risk for developing Alzheimer's compared to non-diabetic? Yeah, that's a lot, isn't it? So, and that applies to both type 1 and type 2 diabetes. 4 times, as high as 4 times. So treating diabetes, particularly getting the glucose under control, is essential. It's essential. Right now, there is a very large clinical trial, globally ongoing, using a diabetes drug in treating Alzheimer's. And this drug was also recently approved for treating people who suffer from obesity. So this is also considered as a weight loss drug as well. So you think about one drug can help with diabetes, can help with weight loss, potentially can also help with Alzheimer's. It's pretty exciting, right? So when you think about it's our body, so it's not like your brain, your body is connecting, and that's why controlling the cardiovascular metabolic risk factors are very important for your overall brain health. So finally, I showed just a couple of resources. So this is Cleveland Clinic. Website called healthybrains.org. You can just go on the website, and it has the app is available on your iPhone and Android. It has a self-assessment. You can take the quiz in 6 pillars area, from your physical exercise, your eating habit, your social engagement, so on and so forth. Then you will get a score, a BHI score called the Brain Health Index, and breaks down to 06 area. You will see exactly where your scores are. You will also get a personalized recommendation as to what you can do to improve your score. So I think that's kind of interesting, because then you can monitor your behavior, and then according to the recommendation provided by Cleveland Clinic. So the other one is the AARP called Stay Sharp. That's part of the AARP member. So I'm one of the founding members for AARP Global Council Brain Health. We started back in 2015, and the work is ongoing. So far, we have published 13 reports, and focusing on what I have talked about, 6 pillars and beyond. We talked about the benefit of music and COVID and dementia and mental health, mental well-being and dementia. So all those are free and available online and in English, Spanish, French, I think some other languages as well. And very comprehensive, but also has really good summary. So those are the information that you can always seek. Just go on their website. So this is just an example in terms of their report. They have different infographic if you don't want to read too much text. So here are some practical tips what you can do. And AARP also has some other program that you can just go on their website. They have really been leading the area in terms of providing very practical, very scientifically proven information and recommendation to help people to stay sharp and stay healthy. So what we have talked about today is really focusing on brain health, as we know that the brain gets older and they become more vulnerable. But there have been great advancement made in terms of diagnosing and treating Alzheimer's. And the brain healthy lifestyle can enhance the cognitive resilience and reduce risk for dementia. So remember the 6 pillars of brain health, and you also know that is all in your control. So you are responsible for your own brain health. So thank you for paying attention. I'm going to start and open up for questions.
Until I get a microphone.
Oh, by the way, hearing loss is associated with dementia. I did mention that. So we are going to be doing another report. Where is AARP? Just talk about hearing loss. Yes, the lady in mask in the last row.
I'd like to know if those pills you see on TV have any effect, like Noriva, Prevagen, or...
I'm so glad you bring that up. I know that question is going to come up. So there is a full report by AARP on supplement. And we look at the evidence extensively. So here's a take-home message. you should talk to your doctor and you should get a thorough checkup. If you have deficiency, for example, if you have vitamin D deficiency, then you should take vitamin D, okay? And if you have thyroid problem, you take thyroid supplement. But short of that, there really is no evidence in terms of the current available supplement on the market on the brain health, on the benefit of brain health. Like, take an example, so take Prevagen, for example. We have about 20 experts and ARP internationally. We all look at the data very closely, and the final conclusion is there is no evidence. Okay, so if you read the ARP supplement report, the top line is don't waste your money. Okay, don't waste your money. And also, I want to caution people that is the manufacture process of supplement is not under FDA's regulation. So therefore, that way, or you don't really know what they put in the pill, tablet. You can just read the label, but it's not governed by FDA. So there are different stories we have heard, right? In terms of different brand of supplement may have detrimental effect on your overall health. So be very cautious when you take supplement.
What about salmon and fish oil capsules?
Yes, so fish oil is a different story, right? So we talk about DHA, we talk about omega-3. So, and the one word of advice is if you want to, if you're really convinced about taking supplement, I would say take something pure. By that I mean, if you think vitamin A, you need that, or vitamin E, or vitamin C, or omega-3. You buy omega-3, you buy vitamin C, you buy vitamin E, rather than take a multi, because you don't know the composition, you don't know what they put there, you don't know the ratio. So yes, so for people who do not eat fish, I think the omega-3 fish oil tablet or capsule is good.
How do you find out about the APO-E4 and the other one?
It's available, so if people want to have their gene tested, it's available. 23andMe, you can do that, or you can even just go to Quest Lab, you can get it. Yes, yes, it's really available. I think the question is, do you want to know? That's the dilemma we are all facing, because there is no cure, and also that even if you have the genes, you may not get it, right? Or if you don't have the genes, you may still develop Alzheimer's. So I think it's ethical, legal, and personal view. And some people say, you know what, my mom has Alzheimer's. I think I'm at a greater risk. I want to know if my risk is higher, and then therefore I can plan accordingly. Other people say, I don't want that hanging on the back of my mind. I want to enjoy the life it is. I want to know. So it's really a personal decision, and right now the clinical recommendations, we do not recommend. We do not recommend. But if the patient or individual want to do it, absolutely, it's available. Hold on.
I think he said white matter around the brain.
Yes, what about the white matter?
Get older, what does it do? What is that part of Alzheimer's or not?
So the whole brain regions can be affected. So we have gray matter, we have white matter. So that when we look at the change of the brain, we don't necessarily look at the white matter per se, but we are looking in specific areas of the brain. So that's why I talk about the hippocampus area. That's where the memory is formed, the memory is consolidated. That's where that we notice the most change in the Alzheimer's patient.
The more white, the worse. The more white matter, the worse it is.
No, it's not. It's not. So it's what is worse is overall the shrinkage of your brain. So it's not so much white matter or gray matter, it's the shrinkage. When the size of your brain reduces, that's bad. Right? So you think about when we get older, our stature shrink, we lose our muscle, we also, the same thing happens to your brain. That's part of the aging process. Yes?
Much of the information showed today on
I'm sorry?
Is most of the information you show today on the internet?
Most of them, yes. I show you the CDC, WHO, Cleveland Clinic, AARP, so I'm just the one who synthesize, organize, and be the messenger. Yes.
Thank you. You mentioned about brain healthy foods,
Yes.
10 groups.
Yes.
Do you recommend all of them or some of them on every meal?
Not necessarily every meal. I think it's hard to do that every meal. So based on the study result, those are the 10 group of what we consider the healthy food groups. Some people may not like wine, some people may not like whole grain, some people may not eat certain foods. But what they recommend is those are the 10 groups of food, and then with the recommendation, they also have the frequency. For example, the green leafy vegetable, they suggest you should have at least 6 to 8 servings per week. Right? For wine and for the grains, probably 4 or 5 times a week. Yes.
Are there currently any open clinical trials going on at the Lou or that you would recommend that feel the necessity for family history?
There are always open clinical trials, either at the Lou Center or at some other clinical trial centers here in Las Vegas and beyond. So obviously you can call the Lou Center, and also that if you go on the Alzheimer's Association website, there's trial match. And you can just enter your zip code and you can type in, and then there usually will be some information I can provide to you. Another organization is called GAP. It's not the closing GAP. It's the Global Alzheimer's Platform Foundation. That's also a very useful resources in which that they provide you the different clinical trial that's taking place in different part of the country and sometimes the world as well. Great. What a great crowd. Thank you.
Thank you so much, Dr. Kate. Thank you.